What have people told me that they want? Sometimes they don't know. They just come for the regular checkup. And it's surprising to both them and to me that maybe something's not perfect or something's not right and it needs to be treated and taken care of. But everybody wants perfect, ideal oral health. That's a goal that most people will have. And so as we talk about that goal and then the opportunities that they have to achieve that, it also requires some home care. So we spend a lot of time talking with patients about what they can do at home preventive-wise or even proactively, things that they can do away from my office that will give them ideal oral health. A lot of times patients express some frustration when a cavity or a problem is discovered. Nobody likes to hear that there's a problem. It involves time in my office and it involves some expense. Nobody likes that. We like to keep things very simple and we want to respect people's flexibility and options in life. But it is important for us and important for people to have ideal oral health. The decay process is a cycle. And Dr. Michael Schuster, a brilliant dentist and doctor, he calls it the dreadful story. The dreadful story involves the principle of entropy, which is a physics principle and law, that without putting energy into a system, that system will tend towards disorder. It'll start to break down, and that's true for our mouth. So the dreadful story is without putting energy and effort into our hygiene, our mouth, brushing, flossing, using some mouth rinses, doing other practices that keep us healthy in our mouth, avoiding some things like tobacco and sugars, and there are other things as well that we discuss with patients during the exam, things they need to avoid, things they need to do. If they don't put that energy and effort into their mouth, then they will tend towards a lower state of order or a state of disorder, and that's the law of entropy. That's the dreadful story. Once a cavity is found and treated, well, we put in a material that's foreign to the mouth. The mouth receives it very well. A silver filling, a composite resin or porcelain or gold, all those materials will be received by the mouth very, very well, but it doesn't hold up like enamel and it will break down over time. So each material that we use to restore teeth and put them back into order has a lifespan, and that's part of the dreadful story. Once you have a cavity, then it's a matter of time until that filling breaks down and new decay starts to form. So the ideal oral health goal takes an entire lifetime of effort and energy that we put into it, both here in our office and the patient at home. We're going to lose that battle with some people if we don't take the time at home with preventive care. So in our office at Chamberlain Dental Health, we'll spend a lot of time with patients talking to them about what they can do at home to achieve ideal oral health. Through the scientific process of discovering, evaluation, and testing, we actually know that there are some risk factors, and we want to minimize those risk factors and increase a patient's resistance to disease. This is a principle that is taught by Pete Dawson at the Dawson Academy. Some of the risk factors are acid levels and the duration that acid is applied to the teeth. Now, where does the acid come from? It comes from what we eat. It comes from the metabolic processes of bacteria that reside in our mouth. So we're not going to avoid acids, but we can choose foods and a diet and nutrition that minimizes those acid levels in our mouth and make us less likely to have cavities. Also, bacterial levels are things that we can control, and that's where brushing, flossing, there's antibacterial medicines or mouth rinses that can be used and employed in a good oral hygiene regimen. Another risk factor is medications. As we get older, we're more likely to have systemic chronic conditions. I don't know if it's asthma or arthritis or high blood pressure or any other number of conditions that physicians will medicate us on, and it's good. It keeps us healthy. It expands and lengthens our life. It gives us a quality of life, those medications, but one side effect that many medications have is xerostomia, which means dry mouth. Dry mouth makes it more likely for us to get cavities and to have oral disease. The quality of our saliva is a risk factor. If we have a good quality of saliva, then we're less likely to get cavities. But if we're on medications or if we have other conditions that make us less likely to produce saliva, we're more likely to get cavities, as I mentioned just a minute ago. And there are some things that can increase salivary flow and reduce that risk of cavities. Genetics is certainly a risk factor. Cavities and periodontal disease or gum disease tend to run in families. Inflammation is something that dentistry is now learning more about, and we're not just trying to treat bacteria or minimize bacteria in the mouth, but we're also trying to approach the body's natural method of handling bacteria and disease in the mouth through the inflammatory process. We want to be able to try and minimize the inflammation or the inflammatory process. Smoking, alcohol, and other social habits can be risk factors. Oral hygiene habits, when not employed, it makes it a risk factor for us. And then the frequency of visiting the dentist. Sometimes an individual, without even realizing it, will go too long without going to the dentist. And so having a regular maintenance program of visits to the dentist is an important part of maintaining ideal oral health. So where does a patient start? We invite you to start by going to your dentist, having a good exam, and asking questions. If your dentist doesn't have time to answer your questions, you might call him up in the evening or write a letter or something to get answers, or you might even find a new dentist. Your dentist should have time to answer your questions and talk to you about how to avoid disease and how to increase resistance to disease. Brushing after each meal. Avoiding sucrose, that refined white sugar that you buy in the grocery store and add to so many products, and that in America and in the Western diet we add to so many foods. Well, it tastes great and it makes eating enjoyable, but it has some effects upon the teeth, and we want to minimize sucrose. Soft drinks is almost an epidemic, and power drinks, energy drinks, those things are commonly purchased and used in the United States, but we need to start minimizing that because it's having a negative effect upon teeth. Those drinks actually are acidic, and I mentioned earlier about the effects of acid in the mouth. But we just need to rinse our teeth, rinse our mouth out. We need to brush, we need to floss. Water pick is a good tool for preventing cavities and reducing inflammation, controlling bacterial levels. So I really like the water pick and have recommended that to patients. We've had good success with patients. In our office, our hygienists are outstanding, and they will do measurements of the gum tissue, and they can give a percentage of the gums, how much of the gum is healthy, what areas of the gum are not healthy, and that represents how much inflammation is in the mouth. The water pick can help reduce that inflammation and make it more healthy. Exercise is important. I believe that exercise affects our mouth. When we don't exercise, we tend to have more inflammation in the body. Our immune system isn't quite as in tip-top shape, but if we'll exercise, we enjoy good health in many, many ways. And then eating a diet that's nutritionally balanced. Those are all things that we can do to start enjoying good oral health. And I mentioned earlier that evaluation of gum health. We set goals with patients. We want our patients to have 5% or less of their gums demonstrating inflammation. And so we've helped patients set goals. We talk to them about tools that they can use to reduce that disease in their mouth. And it was so exciting several months ago to have our first patient actually present with 0% of bleeding, unprobing, or inflammation in their mouth. And since then, we've had 4 patients that have presented with 0% of the gums being inflamed, and that is amazing. Those patients are pretty excited. We were excited, and it's just fun to see patients as they employ the things that we teach them to do at home, that they are achieving success and ideal oral health.